All right. So, hello and welcome to the Lee County Literacy Coalition's Health Literacy Workshop for the month of May. This month, we'll be taking a look at the importance of providing for your mental health and wellness. We're happy to have April Smith join us this month to lead our discussion. April is a therapist who currently works with the Russell County Clinic, branch of the East Alabama Health. She's going to lead us through some of the warning signs to look out for mental health, teach us about the relationship between mental and physical health, and tell us about what resources are available in the county. So without further ado, I'll go ahead and just pass things off to April.
Right. Well, thank you so much. And thank you so much for inviting us to be a part of this. Um, as I'm sure y'all know, mental health awareness, I think, has increased in recent years, but there still is a lot to be done. Um, more more things to share to increase that awareness further. So I'm thankful that we were asked to be a part of this. So like Austin said, my name is April Smith, and I'm the clinical coordinator for our Russell County office with East Alabama Mental Health. And so first we're going to go through some of the early warning signs of various mental health conditions. And there's quite a few. I'm going to try to get to as many of these as I can in the time that we have. Um, so first of all, let's go through early warning signs of depression. Depression and anxiety are things that a lot of people have been dealing with recently, especially since COVID. I think we've seen an increase in the amount of people struggling with those things. But when you hear depression, a lot of times you think feeling sad, not wanting to get up and do things. But there are some other signs that you can look for that maybe will show up, even if you're not feeling, sad or depressed. So lack of interest in usual activities. So if you or a loved one just suddenly stop being interested in your normal hobbies, if you used to really like to garden and you just don't have an interest in that anymore, that can be a sign. Sleep problems. This can be sleeping more than normal or sleeping less than normal. So a lot of times people with depression, they don't want to get out of bed. They want to sleep all day. And then on the flip side of that, a lot of times people have trouble sleeping. They have trouble falling asleep, or they wake up in the middle of the night and have trouble going back to sleep. And then feeling tired throughout the day. Fatigue can be a big indicator. Changes in weight or appetite. So eating a lot more than normal or not having much of an appetite, losing weight or gaining weight without really trying to. Those can be signs. Mood swings and irritability. So like I said, depression isn't always just feeling sad. It can be, you're happy one minute and then you're upset the next. Um, you're irritable more often. We do see irritability being an indicator of depression a lot in males. So maybe males don't have that typical sadness, but maybe they seem a little more irritable, a little more quick tempered. And then feelings of hopelessness. Um, so this might be something to look out for in loved ones. If you start to notice that maybe they are making a lot more negative or pessimistic statements, we all have those thoughts from time to time, but this is kind of a shift in the way that you're thinking about the world. Um, just really feeling like nothing is going to get better or that something bad is going to happen, a shift in the way that you're thinking. All right. So, like I said, with depression often comes anxiety. So, some early warning signs of anxiety can be forgetfulness. Um, so, when you're kind of talking about your memory, working memory is the memory that you're using in your day to day life. So, the memory that you're using to problem solve things, to remember where your keys are, to remember if you took your medication that day. And so, that kind of short term forgetfulness can be an indicator of anxiety. Irritability and anger, like we said with depression, that can also be a sign of anxiety. Anger and anxiety tend to go hand in hand. A lot of times people are angry that they are feeling more worried and anxious. So that emotion kind of comes out more than the anxiety does. Anxiety can be an internal thing. So if you're looking for symptoms in a loved one, you might see anger more than you see the worry. If you're having more physical symptoms, so just some examples: nausea, headaches, shortness of breath, shakiness, stomach pain, those can be symptoms of anxiety as well. Maybe you don't recognize that you're feeling worried, but you notice that you're having more headaches lately. You could be under more stress. Panic and worry that affects day-to-day functioning. So again, if you are having trouble kind of getting through your day without worrying about, half a dozen things, then you might need to consider talking to someone to figure out how to deal with that. And then inability to relax at the end of the day. So just like if that panic and worry is affecting you throughout the day, then when you get home, work's done, dinner's cooked, you should be able to relax. If you're still feeling keyed up, then that could be an indicator. All right. So the next two I wanted to talk about, bipolar disorder and then schizophrenia. And I wanted to mention those because in this kind of decrease the stigma or increase awareness about mental health, we talk a lot about depression and anxiety and some of the less severe mental health conditions. And we don't always talk as much about some of the more severe ones. So I wanted to mention bipolar and schizophrenia. So some early warning signs of bipolar disorder, and these are going to be things that you will probably see in your loved ones that they might not recognize in themselves. But so exhibiting extreme amounts of energy. And we all have those days where maybe we're feeling a little more pepped up, we're feeling a little more excited, but this is going to be, another level. So maybe going for days without sleep and still having a lot of energy, that is definitely an indicator. Having so much energy that you can't really, it becomes hard to function like at work or in school. Um, Acting as if they can do or achieve anything, or if they're more important than others. So maybe suddenly starting to think that they are going to run for president, um, or that they're going to be famous one day, when, in reality, not saying they can't be those things, but kind of, if they're not already on that path and then they start to think that they're going to do these things, then that could be a red flag. Frequent engagement in risky behaviors. So like spending a lot of money, especially if you don't really have that money, maybe buying expensive purchases before bills are paid, or reckless driving. So speeding, not really following traffic laws, those can be signs. And then inability to recognize the potential consequences of this behavior. So a lot of times with bipolar, when they're in that what we call the manic episode, which is where they're usually in a good mood, they have all this energy, they don't really think about, oh, there are going to be consequences of this. They think that nothing bad is going to happen. So if you try to talk to someone about your concerns and they kind of brush it off, they don't really see anything wrong with it, then that could be another indicator. All right. And then schizophrenia. So bipolar disorder and schizophrenia do typically develop in late teens to early 20s. That doesn't mean that those things can't develop later in life, but that those ages are really when you're going to start to see it. So if you have someone in your life that is around that age, and you start to notice some of this stuff, then that's probably a good indicator that they might be developing this. So paranoia or suspiciousness of other people, especially if they don't really have any evidence or any concrete reasons why they are suddenly paranoid of others. Social isolation and increased introversion. So, if a person starts to become paranoid or suspicious of others, then isolation kind of goes hand in hand with that. If you're paranoid about people, you're probably not going to want to be around them as much. Difficulty communicating and disorganized speech and behavior. So a lot of times someone who has schizophrenia or another mental health condition, their thoughts aren't really organized. And so when they're trying to communicate those thoughts to others, it doesn't come out like they want it to. They might just say words that don't really make sense or don't flow together, and that can create issues with socialization. Delusions and hallucinations are key parts of schizophrenia. So if your loved one says something that is just, not true, has no basis in reality, or if they start responding to people that you cannot see, so like talking to themselves or having a conversation as if someone was standing there, but you can't see anyone, that could be a sign of something. And then decreased self-care and poor personal hygiene. We see this a lot. For whatever reason, a lot of people with schizophrenia or other psychotic disorders just don't take showers as much as they should, maybe don't brush their teeth, don't clean up after themselves as much. There's just not as much of that kind of motivation to take care of themselves. All right. So ADHD, and I did break this up into children and teens and then adults because, I think that especially now we're seeing a lot more ADHD in adults that maybe went unnoticed as when they were kids. So I wanted to break it up. But so in children and teens, trouble focusing, fidgeting, squirming, or other difficulty sitting still, excessive talking or interrupting others, engaging in activities loudly and disruptively. So, if you're at a family function and you tell your child to go sit down, to go entertain themselves, and they struggle with that, if they keep coming back to you, wanting more attention, that could show that they're having trouble, kind of being on their own. They just can't sustain that attention for long amounts of time. And then once they get into school, so making mistakes on schoolwork, trouble finishing assignments, or having trouble staying organized, frequently forgetting things, and then increased frustration and sensitivity, because these things are frustrating, especially once they get into school. If they are struggling with their grades, if they feel like they're not keeping up with the rest of the class, they're going to feel frustrated about that. And they're probably going to feel sensitive about their inability to do those things. Okay. And then in adults, so similar things, but trouble passing classes or completing work assignments, issues with self-esteem. Sometimes people will kind of start to use substances to cope with some of this stuff. So substance misuse issues, relationship challenges, and then difficulties at college or at work. So like I said, a lot of the same stuff with children and teens, as well as some additional things that kind of come with being an adult. All right. So OCD. And OCD is one that doesn't get talked about a whole lot either, but it is something that a lot of people really struggle with. So some early warning signs of that: repetitive behaviors and needing to repeat an action until it feels right. So I had someone not too long ago who came in and said that sometimes they have to shut the door several times because it just has to feel right. And there's nothing that they can really say about why it feels right or what has to happen to make it feel right. It's just some internal feeling that they have. And so this can cause issues with the people around them, because if you're ready to go somewhere and then they have to shut the door 5 or 10 times before you can go, that can cause conflict. It can make you late. Excessive worries or doubts. So a lot of times with OCD, the person has this fear that something bad is going to happen. And they engage in these behaviors or compulsions, hoping that it will stop that bad thing from happening. So, if I have a fear that I'm going to get some sort of disease, then maybe I'm going to wash my hands a lot more often than I normally would to try to prevent that from happening. So difficulty adapting when things don't go as expected or when plans change. So a lot of times people with OCD can be very rigid in their thinking. And that is because, they have this belief that I have to do this thing to prevent this thing from happening. So when they have to adapt, that can be difficult because that worry creeps back in. Reassurance seeking or rechecking, checking multiple times to see that the door is locked. So kind of similar to the needing to do this thing until it feels right. I have to check the door multiple times to make sure it's locked, and I have to do that until I feel sure that it is locked. And then uncontrollable intrusive thoughts, images, or urges that occur over and over. So that's the key part of what OCD is. You have these intrusive thoughts that you can't really do anything with. And so you start to do these compulsions to try to manage those thoughts. All right. And then PTSD. So intrusive thoughts or memories of the traumatic event. This would include dreams or nightmares as well. We see that a lot with PTSD. Changes in emotional reactions. So if a loved one is much more, like if they get angry more easily, or if they are startled more easily than they normally are, and they've been through something traumatic, that could be an indicator. Avoidance of reminders of the traumatic event. So maybe they take a different path home because they don't want to pass the spot where maybe a loved one passed away. Memory problems and dissociation. So being more forgetful, having maybe issues with their short-term memory. And then dissociation is essentially where the person is present, but their mind is not. So they have dissociated and they're not fully present in that moment. All right. So those are our early warning signs of various mental health conditions. And so I would encourage y'all to just be mindful of those in yourself, as well as if you start to see these things in a family member or a friend, let them know that this is a concern and that they might want to talk to someone about getting some help. All right. All right. So mental health does not exist in a vacuum. There is a big connection between mental health and our physical health. And so research has showed that some conditions like diabetes and high blood pressure can actually cause stress-related changes in the brain that can then lead to mood and developmental disorders. So if you're not taking care of your physical health, then these changes in the brain can happen. And then you're looking at maybe depression or anxiety on top of diabetes. And then on the opposite side of that, certain mental health conditions can cause stress that can lead to physical health conditions. So I'm sure that most people know if you have high blood pressure, or I'm sorry, if you're under a lot of stress for a long time, it can raise your blood pressure, which then can create more stress, more potential mental health concerns, and then you're kind of looking at a cycle. So that's why it's very important to keep up with these things, to maintain a check on your blood pressure, see a doctor regularly, and try to do what you can to prevent these things from escalating and getting worse. Mental illness may speed up aging due to increased rates of heart disease and other age-related illnesses. And actually, schizophrenia has been associated with up to 10 to 20 years shorter life expectancy. And that kind of goes back to what I was saying about just not always taking care of yourself, not keeping up with your physical health, maybe not taking medication like you should. But I do want to clarify that just because a person has a mental illness does not mean that they are automatically going to have physical health concerns as well. And that's why it's so important to make sure that you're taking care of yourself, taking care of both your physical and mental health. Like I mentioned, mental illness can lead to unhealthy behaviors such as poor diet, lack of exercise, substance use, sleep issues. And so those, of course, go hand in hand with physical health. And then stress can cause long-term elevated levels of cortisol, which is the stress hormone. So it's what is released in our brains when we're feeling stressed. And when you have elevated levels of that for a long time, then that starts to impact pretty much all of our bodily systems. So our digestive system, our immune system, our cardiovascular system, pretty much anything. So that's why keeping stress down, taking care of yourself is so important. And here are actually some tips for taking care of your physical and mental health. So exercising regularly. So the American Heart Association does recommend that adults get 30 minutes of exercise 5 times a week, which probably sounds like a lot, especially if you're not really exercising regularly. So that's why I said start with aiming for about 10 minutes a day. Take a walk for 10 minutes. And then gradually work up as you feel comfortable, as you kind of get into a routine, as your body allows you. Start to work up 15, 20, eventually get to that 30 minutes or longer, however your body is able to do so. Eat a healthy diet. So we all need to drink more water. We know this. Eat more fruits and vegetables and be mindful of processed foods or foods that have a lot of sodium in them, because that can raise blood pressure, of course. And then practicing mindfulness. Mindfulness is another term that I think is kind of one of the buzzwords lately, but mindfulness just means being present in the moment. So not distracted by your phone or by the TV or by anything else. And just taking notice of where you are and how you're feeling. And it is hard to find time to practice mindfulness. But if you can do it for a few minutes when you first wake up, before you go to bed, maybe when you get home from work, to put your phone down, maybe, turn some quiet music on or some ocean sounds or something and just be. And don't think about what you have to do tomorrow or what you're cooking for dinner. And then after a few minutes are over, then you can go back to life. But you know that you have those few minutes to just rest and relax. All right. All right. So if you feel that you need some help with your mental health, or you feel like you have a loved one who needs help, there are many, many resources in Lee County and in the surrounding areas. So of course, I'm going to mention East Alabama Mental Health because that is where I work. And East Alabama Mental Health is actually a good agency for those who do not have insurance, so lower income individuals. We operate off of a sliding scale, so it is based on your income. And we do as much as we can to work with people and to get them the help that they need without cost being a barrier. A few other agencies in the area, so Rivertown Psychiatry, East Alabama Psychiatric Services, the Hawkins Group, Alabama Psychiatry. And then Psychology Today is a website where you can go and kind of type in what issues you might be, needing help with, or, if you feel like, okay, I really need someone who specializes in this certain thing, then you can go to Psychology Today and search for that, and find a therapist in the area that will be a good fit for you. And then I put a couple things on here for more immediate assistance. So East Alabama Medical Center is, of course, the hospital in Opelika. They do have a psychiatric unit for both adults and children and adolescents. So anytime that you are in need of immediate assistance, you can always go to the emergency room, or, take a loved one to the emergency room, and they will be able to assist. And then the 988 Crisis Lifeline. So that has recently replaced the previous suicide hotline. So it's kind of 988 is essentially the 911 for mental health. So if you or a loved one are experiencing any thoughts of harming yourself or harming anyone else, or if you just need someone to talk to right then and you're not sure where else to turn, you can always call 988 and someone will be there to help. And I believe that is about it. What questions do we have?
Hi, and thank you so much. I have a question. Do you know, do the other providers that you listed offer services on a sliding scale, and do they take like regular health coverage?
So let's see. So as far as I'm aware, Rivertown Psychiatry does take insurance. I know that they take Alabama Medicaid. I am not as familiar with the other agencies' sliding scale, kind of how they operate there. And then with the others, such as East Alabama Psychiatric Services or Alabama Psychiatry, I believe that they take Blue Cross Blue Shield. I'm not sure about Alabama Medicaid or the other private insurances. And again, not sure about sliding scale for them either.
Okay. The next question is for, the East Alabama Medical Mental Health Center.
Mhm.
What's the wait time? Is there what's the time to get to start getting services? Is there a wait
Sure.
time?
So there is. So basically when you call to schedule to start services, then they will ask kind of what's going on. And then depending on what the presenting issue is, if it's something that's very, needs to be taken care of immediately, then they can work to get them seen, in the next day or two. But if it is kind of a more routine call to start services, there's probably about a couple of weeks wait to get an intake.
Mhm.
And that kind of fluctuates just depending on, how many people we're seeing at the time. But I would say typically it's about a 2-week wait.
Okay. And the last question
Mhm.
is, are there any support groups like where people could go while they're waiting to be seen, or maybe they have a less significant presenting issue?
Mhm. Um, so I know that the first one that comes to mind is NAMI, which is the National Alliance for Mental Illness. A lot of times that is kind of more geared towards family members of individuals with mental illness. But I know that they have meetings, and I would have to get that information. Maybe I could share that after this presentation, but I know that they do have meetings at least once a month, I believe. Other support groups, if someone is dealing with like substance abuse issues, there are always AA or NA meetings. Those are all the ones that I can think of off the top of my head. But like I said, I could do some research and see if there is anything else.
I have a question. So once I know you stated that this, I know you stated you work at East Alabama Mental Health. Once your client leaves and is stable, how do you all follow them, or do you all follow them? Or do you send them to like a halfway house or some type of clubhouse model? Or how do you follow them after they are discharged?
So East Alabama Mental Health. So I work like as an outpatient therapist. We do have an inpatient crisis stabilization unit. And then East Alabama Medical Center is going to be the inpatient unit as well. So when people are discharged from those facilities, we get them an appointment with a therapist within 72 hours of discharge. And after that, we try to see them at least once a week to keep up with, with their stability and make sure that they're doing okay. And so from then it's pretty much just outpatient therapy and seeing the doctor for their medication. And then, just depending on what they need, we can try to make referrals or set them up with other services that they might need.
Thank you.
You're welcome.
I have one last question. I total fib. For the stigma and some of the stigma that may be present in any community, what would you tell someone to help someone to kind of remove some of that stigma, or some beginning conversations to introduce them to gaining therapy?
Sure. So, something that I tell everyone is mental health can be looked at just the same as physical health. Someone has high blood pressure, there are things that they can do to manage that. They can eat a better diet, they can take their medication, they can exercise, and it's the same as mental health. If you're struggling with depression, there are things that you can do to manage that. And just like you have to see a doctor for high blood pressure, sometimes you have to see a therapist or a doctor for depression or for any other mental health concern. So that's kind of how I try to reframe it. That, as well as I think just emphasizing that mental health conditions are not a weakness or something because of something that they did wrong. It is something that happens. It doesn't mean that they're a bad person. And sometimes we have to get help from other people. Just like, I keep coming back to analogies, but just like if I have a flat tire, I probably can't change that on my own. I might need to get help for it. And it's the same thing. We can't always go through life on our own.
To add on to a question that was asked earlier, both the Hawkins Group and East Alabama Psychiatric, they both take insurance, but neither operate on a sliding scale based on income. Additionally, neither of those are currently accepting patients, which kind of leads to my next question to you about. It's great to hear that y'all only have like a 2-week wait time, because I personally have been like trying to make some calls around Lee County to try and like get seen. And I'm hearing like 3 months at the earliest for the people that are even like accepting clientele right now.
Oh my goodness.
So how often do you hear about people having to who live in Lee County go to different cities or different counties to be able to receive help?
Fairly regularly. So East Alabama Mental Health, we do serve 4 counties. So Lee, Russell, Chambers, and Tallapoosa counties. And so we have had times where maybe the wait was a little longer than 2 weeks. And we have people ask, well, can I go to one of your other counties that maybe has a shorter wait? So that does happen from time to time. As far as, other agencies, I know that a lot of people are not accepting new patients right now. And then so East Alabama Mental Health, we are always accepting new patients, but when other agencies stop accepting new patients, then you have more people coming to East Alabama, which we are of course grateful for, but then of course that does end up increasing wait times. So that's kind of something that just ebbs and flows. We have periods of time where we do have a big wait, and then we have periods where you could be seen next week or maybe later that week. So just kind of depends.
Okay. I had another like 2 questions, if that's okay.
Sure.
One is earlier when you were talking about some of the different warning signs for illnesses, I saw that there was like a significant overlap between a handful.
Mhm.
Would you be able to speak a little bit more about the difference between the like how worrisome like thought processes appear in people with OCD versus like anxiety? Because I feel like that's kind of like a blurred line for a lot of people.
Absolutely. Okay, so what's the question again? I'm sorry.
Yeah, sorry. How anxiety or worrisome behavior might present differently in those with an anxiety disorder or somebody who has OCD.
Okay. So the kind of the biggest thing with OCD is going to be, I'm worried that this thing is going to happen, and this is what I need to do to prevent that thing from happening. And usually those things are not tied together. I know that I gave the example of, if I'm worried that I'm going to get some sort of physical disease, then maybe I'm going to wash my hands more often. But sometimes it'll be things like, I'm worried that something's going to happen to my mom. And so therefore I'm going to line up all the books on my bookshelf in order of height. And so like those things don't necessarily have anything to do with each other, but for whatever reason, my thought process is that one will help the other. And anxiety sometimes is more, maybe one has more to do with the other than an OCD. So if I go in public and I'm worried that people are judging me, then I stop going in public. Or if I'm scared that I'm going to get in a wreck on the way home, then maybe I take a different way home where there isn't as much traffic, or I leave an hour earlier or an hour later to miss some of that traffic. So they are very similar. One is just a little more disconnected and takes up more time in a person's day with the compulsions. So OCD, they're going to be spending a lot more time during their day engaging in those compulsions. So spending hours washing their hands, or spending hours cleaning, or lining up things, whatever it may be.
Okay.
Does that make sense?
Yeah, so it's kind of like both may participate in like actionable behavior to relieve the anxiety, but it's more on the regards of the effectiveness or connectedness of the action to the effect.
That's part of it. And then I think also just the intense need to do those things with OCD.
Okay.
So with anxiety, okay, yes, I might like to leave the place where I'm at because I'm feeling anxious, or I might like to, take a different way home or whatever it is. But I don't feel as driven to do those things. as in OCD. OCD is going to be, I have to do these things. And if I do not do them, then I'm going to feel anxious and I'm going to get upset, and other people are going to see that.
Okay. And okay, cool, that makes sense. And then my last question would be, I've heard that there, like for a long time, is like a general misconception between like borderline personality disorder and uh it was one you talked about earlier. It also starts with a B.
Bipolar.
Yes. What do you think contributed to the like kind of crossing the wires on that?
So how they can look very similar,
Yeah.
or what do I think contributed to the crossing of wires?
Yeah, well, I've often like heard people say like if somebody has like very quick like emotional regulation issues, I've heard people throughout my life say they're bipolar, like as a
Mhm.
borderline or something like that. When that
Right.
doesn't seem to actually be tied to that illness, it's more tied to borderline. And I wasn't sure if you ever
Sure.
had anything for like how that came to be.
Well, so with bipolar, you have ups and downs. You have very high highs and very low lows. Um, and some people go through the cycles of that much faster than others. And I think that is probably how it came to be, just kind of misinformation about how quickly those cycles happen. Because yeah, I mean, you have a lot of people who say, well, he's fine 1 minute and then mad the next. He must be bipolar, which is just, I think it takes what bipolar is and just kind of warps it into something similar, but something that it's not. So you do have the emotional, you have periods where you're really good, and then periods of depression, and then periods where you're kind of in the middle. But those last for a lot longer. And I think that that's probably the part that maybe people who have heard about what bipolar is, that's the part that maybe they didn't hear. They just heard about the emotional reactivity and not what it actually looks like or how long it actually lasts.
Okay. Mhm. That's all the questions I had. Thank you.
You're welcome. Any other questions?
No, thank you so much. Can you remind us of your phone number one more time?
Yes. So for East Alabama, let's see, there's all the numbers. So for East Alabama Mental Health, that number on the screen is to our outreach department, and that is where all of our first time appointments are scheduled. So to schedule an intake, which is the first, that's the first appointment we do, then you would just call that number. They'll get some information and then get you set up.
Well, thank you again so much for making the time out of your day, April. We really appreciate it.
You're
And
so welcome.
thank you to everybody at East Alabama Mental Health for the work that y'all do. Like, as we've learned today, it's all very important. And, well, thank everybody else who joined us today.
Thank you,
Thank y'all
April.
so much.
Thank you. It was really good.
Thank you.
Okay.